Welcome to the 14th Analyst Talk focusing on clear aligner orthodontics. John Kreger, Senior Healthcare Analyst at Blair, interviews Dr. Sam Daher, who has been a leading expert in clear aligners for the past 18 years. Sam has personally treated over 5,500 patients in Canada since he adopted this treatment technology.
All right, so Dr. Daher, when you started using clear aligners, what were their limitations?
So early on, in around 2000 or so, clear aligners were limited to minor crowding. And most of us actually used it for that purpose, usually lower anterior crowding or relapse. So it was quite limited. I would say maybe 5% of the malocclusions.
What percentage of your cases would you say were appropriate for clear aligners back then?
It was less than 5% of the malocclusions that we see on a daily basis were treated with aligners.
How about today?
Today, one of my practices is 100% aligners. So I treat in one specific practice every single malocclusion with aligners. My other practices where I have my associate, I'd say 50-50 braces and aligners.
I know you have quite a bit of experience with Invisalign. How have you found ClearCorrect in your experience with that one so far?
So comparatively speaking, I tested ClearCorrect obviously before diving in, and I found that for the majority of the cases, not much of a difference. You can see that the everyday, the Monday morning cases, so to speak, are treated similarly between aligner, between Invisalign and ClearCorrect. So the vast majority are similar. Maybe when you have certain challenging cases, which are a small percentage of the malocclusions, Invisalign still has the edge at this point, but I can see that change in the near future.
How do you assess the different clear aligner products that are on the market right now? Is it price? Is it ease of use? Is it outcome?
So when I think of clear aligners, when I'm in my mind comparing these different options, price, to be the truth, is the last thing on my mind. I want to see how they behave. I want to look at the plastic. I want to look at the software. I want to look at ease of use. I want to see how comfortable it is for the patient. So these are the things that I judge before jumping into price. Prices are more or less similar. There's several companies out there and prices are not that far off. So that's really not a deciding factor, but ease of use, comfort, how well does it accomplish what I'm trying to do orthodontically, and this is how I really decide on which product to use.
Any thoughts on the direct-to-consumer models that are out there now, like Smile Direct Club? Do you think that's appropriate opportunity for consumers?
So companies like Smile Direct Club and the direct-to-consumer, I believe there's a lot of negative. There is some positive. One of the positive points is that it educates the public, which is good. So people will look around, they'll ask, they'll get educated, they go online, they ask questions, which is really good. The negative thing is these direct-to-consumer, there's no follow-up by the doctor. So you may make the 6 front teeth look good and the aesthetics look good, but what we're ignoring here and what we're forgetting is the occlusion. The teeth, when you take 2 teeth that are overlapped and you straighten them, what ends up happening is you may create an overjet, or you make the overbite deeper or shallower. And all these are negative. These are negative points. These are important points for any treating doctor. So we have to focus on the aesthetics, but we cannot forget the occlusion. Function and health are extremely important to any treating doctors, and the patients should be concerned as well.
That concludes the 14th edition of Analyst Talk. Thank you for your interest, and we hope that you will tune in into the next edition later this year. Goodbye.